and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am joined by Lucille Brennan, the Guest Empowerment Coordinator at The Gathering Place, which is in St. John's, Newfoundland, and Cristina DiTomaso, the Manager of Community Health and Wellness at Rideau Community Health Services in Merrickville, Ontario. This episode I'm really excited to bring together because we are going to be discussing services that community health centers provide specifically for senior clients, especially during these colder months that we are currently experiencing, I'm sure in St. John's, Newfoundland, as well as here in Ontario and across Canada. Thank you both so much for taking the time to chat with me today.
You're welcome.
Thank you, Hilary.
You. Cristina, I'll start with you. Would you like to tell me a little bit about Rideau as a community health center, the community that you serve, some of the programs and services that you provide?
100%. Thanks for having me. So Rideau Community Health Services, like most community health services or community health centers across the country, is a not-for-profit organization, and we're governed by a board of directors who are volunteers. We were incorporated about 50 years ago, 1974, so we've just celebrated our 50th anniversary, and we offer a plethora, a diversity of programs and services, and we have a very large geography that we serve. So our corporate office is located in Merrickville, as you alluded to in your introduction, but we actually serve the greater area of Lanark, Leeds, and Grenville County. Now that is sort of southwest of the great city of Ottawa. We're not part of the city of Ottawa, and primarily rural. So really rural Eastern Ontario is sort of the locale of the folks that we serve. We have a wide variety of programs and services. So again, like most community health centers, we have primary care. We provide diabetes education. We have counselors on staff. We provide telemedicine, lung health, and all sorts of community health promotion and well-being programs. And I think we're going to talk a little bit about that a little later on, so I won't give too many of the secrets away. And we're an interdisciplinary team, again, like most community health centers, and supported by a tremendous admin team, and all kinds of partners in our community. So we don't do this alone, along with other community agencies, to be able to provide service to the folks that live in our communities.
Amazing. Thank you so much for sharing. And Lucille, I'm excited to hear about the Gathering Place, and also, as we mentioned before, the only community health center in Newfoundland. So I'm really excited to hear about your community health center and the programs and services that you provide for the community there.
Well, we cover Newfoundland and Labrador, and we're the only one, as you mentioned. We're located in the downtown core of the city, so there would be easy access. We serve the most vulnerable and underserved in our province, which is a privilege and an honor for us to do. We focus on social determinants of health. We have a medical doctor here. We have a dentist program. We provide foot care. We have eye specialists coming in. We have a literacy program through the Murphy Center. Currently, I'm running a stop smoking program with a pharmacist. We have case management teams made up of social workers that assist people with income support and any other issues they may have. I do a lot of the art and bingo, and we have a garden. We have a bike shed that we give away about 100 bikes every year that are repaired by our guests. We call our clients guests, so they come to us. We do group work. We have a grief and loss counselor that comes in. We have the Listening Post, which is a community group that comes in just to listen to our people, and they can unburden their souls and not worry about judgment or anything like that. We also have a recovery group, addictions recovery group that I run. We serve 3 meals a day. We have a shelter that houses 40 people each night. We just started transitional housing. We have free laundry services. We have a free boutique. And our main role here is to build a sense of belonging for the individuals that come.
Wow, that's amazing. That's so much stuff. That's absolutely wonderful. And for such a big area as well. Congratulations, both of you, for doing such amazing work. So I'm curious, as I mentioned, with it, I will say, I've wanted to do this episode for some months. So I keep saying the cold winter months, but it was 18 degrees here in Toronto this week. So now I feel a bit like, well, it's spring, but we still have, the burden of Canadian winters. I'm curious about, access to programs, how the access to programs and like dealing in community, it can be difficult, obviously, when it's much colder. And seniors are obviously quite vulnerable during this time of year specifically. And of course, they are, all year round. But Christina, I'll ask you first, do the seniors in Merrickville and the Lanark area, do they have any specific needs to this time of year, or even any other specific needs you'd like to highlight for the senior community specifically?
Yeah, so I think, like all our communities, winter months are difficult. Specifically with older adults, and particularly in a rural community, things like transportation and isolation and limited incomes. We have a number of older adults in terms of who are food insecure. So, a lot of the similar things that Lucille talked about in terms of working with those folks that are the most vulnerable, older adults fall into that category as well. I think there are challenges and or considerations around caregiving roles that folks play when you're an older adult, whether that be for your spouse or your partner or the family members that perhaps are taking care of you as an older adult. There's grief and loss that needs to be taken into consideration as we grow older. There's all sorts of types of losses that we encounter, not necessarily just associated with death, but other losses. We also see a fair number of homelessness or precariously housed folks who are older adults. And I think, this is not a phenomenon that is specific to our particular geography, but certainly access to primary care. So there are a number of things that just get deepened in terms of what, Eastern Ontario winters bring to older adults. And those are some of the issues and some of the conditions that make our older adults so much more vulnerable during the winter months.
Absolutely. Thank you. And Lucille, how about for the seniors in your community? Do they have any specific needs as well? That's any different or very similar to what Christina shared as well in regards to both winter and also just, the barrier of aging in these communities that already, have these other barriers?
Yes, well, the demographics in Newfoundland show that we have one of the largest proportions of seniors in Canada and one of the fastest growing populations of seniors. Some of the issues that we're dealing with, there was a report recently done and completed by the Seniors Advocates Office, which is a statutory office with the House of Assembly. And they noted that only 14% of our seniors get access to fresh fruit and vegetables for the 5 recommendations daily, that only 14% of our seniors reach that recommendation. So the cost of food here is absolutely outrageous. I don't know how people are doing it. Our seniors are deciding to either eat or have oil in their homes to heat it. So a lot of suffering takes place because of poverty. We have 44% of our seniors in Newfoundland receive access to the guaranteed income supplement. So that's 44% of our seniors living in poverty, because the guaranteed income supplement does not take you out of poverty. So that has a big impact, because with the price of rent, the price of oil, our seniors are doing without a lot of things in order to pay their bills. And a lot of seniors are also having to leave their homes because they can no longer afford to stay there. We're seeing a large number of seniors coming into our shelters right now because it's very hard to find housing for individuals. And the government is responding to this issue, but everything takes time. So it's very heartbreaking to see seniors come into a setting because this is their first time ever experiencing homelessness. Our seniors are isolated during the winter here. We have extremely bad winters, a lot of snow. The sidewalks aren't plowed. So a lot of our individuals can't get out to catch a bus because they have no way of walking to the bus stop. They also can't take their garbage buckets out from their apartments or homes because of the snow. It's difficult they're very limited in attending social events if they can't if they can't get access to transportation. We also find that getting access to things like special bus passes and home care, it all involves computer work. And a lot of our senior guests don't know how to use the computers. So they're totally dependent on frontline workers to assist them. And a lot of people won't even come in and ask because they don't know what they're asking for. So that's where our case management team really comes in handy. But I think the biggest thing I see here in Newfoundland is the loneliness our seniors experience. You know, when they come, our demographics at the Gathering Place have really changed over the last 6 years. When I came here 6 years ago, the majority, 55% of our 65% of our population were seniors over the age of 55. Since then, we've changed and we got a very young group coming in now, a lot of addictions and mental health. So our seniors kind of get lost in all this. So part of my role is to make sure that when I see them in our building that I engage them, and they have so much to offer. Like I have one woman who volunteers with me. She just turned 77 today. And she's teaching us how to do embroidery on pillowcases. They've taught us knitting, crocheting, like a lot of the lost arts that are gone that people don't do so much anymore. The seniors are bringing all that back, plus a sewing program, and they make quilts. They're very handy, and they're teaching a lot of the skills that are being lost to our younger people.
I was going to say, if I need those skills. Thank you. Yeah, that's absolutely like wonderful to hear what the positivity coming out of this. And yeah, it is in these snowstorms and in these like horrible moments that I think like I can't imagine if I'm having trouble getting out of my own home at a spry 31, I can't imagine what it's like. And of course, the digital inequity. I mean, we've been seeing this for a long time, but COVID made it so much more apparent to me about these difficulties, and to see this continue in terms of people needing support and accessing and navigating these systems is so difficult. So thank you so much for shedding a light on that. Lucille, I'll ask you again. I'm curious as well about the seniors' mental health and obviously the impact that all of this is having, and how this might compare to other populations that you're serving as well, and the unique mental health challenges that they face in these times.
Mm-hmm. I find the most difficult thing with our seniors right now is because there was such a stigma attached to mental health in their time of growing up and growing older that they're very hesitant to talk about it. And some people can't even identify it's their mental health that's affecting the way they're thinking and the way they're looking at life. We see a lot of individuals with cognitive disabilities, and we arrange assessments for them. And sometimes they don't, they tell me, I wasn't really truthful on that assessment because I don't want to go into an old age home. So they're hesitant. They don't trust systems a lot. But mental health is really a big issue because they lack the supports that they had at one time in the community. A lot of their friends have passed on, and you know, their families live elsewhere. As you are probably aware, Newfoundland, a lot of the young people leave to go to work elsewhere. So a lot of the seniors are basically left on their own, and a lot of their community supports have passed on. So mental health is definitely an issue that we deal with. There's very long wait lists to get in to see somebody. Also, our seniors in shelter require higher levels of support. We have a lot of our seniors in shelter that require help with their personal needs. And we as a staff we're not qualified or expected to do that, but we do it because nobody else is going to be doing it. You know, our seniors today, you know, they have one of the longest wait periods for hip and knee replacements in Canada. You know, our seniors don't get medical care, lack of family doctors, the same as the rest of Canada is experiencing, we're experiencing also in Newfoundland. So our medical clinic really fills in for a lot of that. And without our community, we couldn't do this work. We also have about 200 volunteers that work with us. And I would say 50% of those volunteers are seniors who've been volunteering here for over 25 years. They help serve the meals. It keeps them engaged also in our community, and it keeps our senior communities who access service engaged with other seniors who are, you know, serving them in the community. So they make friends that way too.
Thank you for sharing that. And Cristina, what about the community that you're serving and their mental health, and how are they feeling during these, you know, difficult times?
Yeah, and I think I want to echo everything that Lucille just said. So even though we may be in very different geographical areas, I think the folks that we serve and specific to our older adult population are experiencing, very much the same barriers, the same challenges. We're all human and certainly our experiences are similar, even though we may not be geographically close to each other. I think as well, we need to recognize that post-pandemic, which was a terribly difficult time for older adults in particular, post-pandemic, I think, again, to echo what Lucille had to say about the stigma and the trusting of systems and those sorts of things, we certainly see that in our older adult population. Timely access to mental health supports is certainly just as challenging here in rural Eastern Ontario as it sounds like it is over in Newfoundland and Labrador. But well, not but there are other pieces that sort of layer into that. And I spoke a little bit about it earlier. So this idea of loss and grief. So as we grow older, there are a greater number of losses that we occur in our lives. The heightened level of isolation, which was experienced during the pandemic. We were being told, certainly in our communities, to sort of create bubbles where you limited the access you had to folks. And for many older adults, they were a bubble of one. And that has sort of permeated into and continues to be the case even post-pandemic. So folks are isolated and needing to build those support systems. And as our physical health deteriorates alongside our mental health, right, they sort of go hand in hand. So, Lucille, you spoke to that, the predominance of cognitive symptoms coming to the fore, and dementia and loss of memory. So, those are examples of the physical deterioration as well as the cognitive. Again, to echo Lucille, things around food security and limited income and substance use, all of those are the sort of layers and unique challenges um, for older adults to have to work their way through. And I would agree that the stigma and the mistrust of systems probably plays into folks' ability, along with the digital equity and the digital literacy, folks' ability to tap into services and to the systems that exist that are currently, certainly here in Ontario, overtaxed, right? There's a fairly lengthy wait list for any mental health services, whether you're an older adult or anyone else on the age continuum. So echoing certainly what Lucille had to say about what's happening out east.
Love that there's synergy, although I don't love what that it's necessarily synergy over the same difficulties within the system. But I appreciate that actually, that we're able to come together as a national body through, we're experiencing the same things despite the difference geographically. Christina, I'll get you to tell me a little bit about what Rideau is offering in terms of specific programs or resources that are able to help combat some of the issues that you were just describing.
So, I mean, it starts with primary care. They're certainly the largest sort of component of the services and the programs that we offer. We have both physicians as well as nurse practitioner and a whole sort of crew of allied health professionals that can support folks, including older adults who come through our doors. We have a diabetes education team who can work with folks around their either newly diagnosed or long-standing diabetes. From a mental health, we have a counseling team and we have folks on site with us from the Ontario Structured Psychotherapy Program. So enabling sort of this seamlessness, one door, right care at the right time in the right place. That's really what I think the model of care is for CHCs, and we're part and parcel of that. Offering nutritional counseling. We have telemedicine programs. So for folks who are experiencing isolation, maybe can't get into some of the larger communities like Ottawa and or Brockville, being able to offer appointments and other things as well, including our exercise program through a telemedicine, which is a virtual access to services. We have numerous community health promotion and disease prevention programs. I'd like to focus a little bit on one aspect or an example of our health promotion team. And specific to your question around, so how do we support folks through sort of the challenges, experiences that our older adults experience through the wintertime and certainly with their mental health? We have community health workers, and they're available for folks to access to help navigate the systems and to be able to access, community resources such as things like we've been talking about food supports or housing information or income supports. And they lean heavily into accessing transportation because we don't have a public transportation system within the geography. Well, we have some limited sort of in little tiny pockets of the community, but we certainly don't have a community-wide transportation program. And our CHWs, our community health workers, are available, to meet with folks, whether it's in the office, they can do it over the phone, they can meet virtually for folks who have that ability. And it's really about assessing needs and the goals of the person who's on the call to work collaboratively, right? We figure out, so what are your goals? What are the things that we need to work through? And systematically, these community health workers work brilliantly with community members. We have a great number of older adults who come through the door and access our community health workers. Now, it is a short-term service, and it's really geared at being able to connect folks with the right resources and the right supports at the right time. But it doesn't prevent folks from building that connection with our community health workers within the organization and then coming back the next time there's something else that they need help with and the next time. So it really is around building that support system for folks, hoping to break isolation. And I think later on, we'll talk a little bit about some programs or some specific services that help with the breaking of the isolation.
Absolutely. Thank you. And Lucille, I know you gave a very robust response right at the top of everything that is at Gathering Place. And I could tell which ones were, senior geared, but I'll give you another opportunity as well to share other specific programs or resources or anything you want to highlight that helps seniors with their isolation or any of the barriers that they face.
Well, as I noted earlier, we do have a case management team, and that case management team consists of social workers, and they will assist any seniors that require help with housing, with transportation, with medications, with specialist appointments. So they do. We do have a whole team that deals with that. We also have one of the things I really engage volunteerings in. Our seniors in volunteering with us. So as I noted earlier, they're very active in our arts program. Bingo, they call back bingos. We have talent shows where they participate in it. And we love dancing in Newfoundland and Labrador. So usually on Fridays at the end of every month, we try to have live entertainment. And sometimes our seniors will get up and perform, and they'll always get up and dance. They're usually the first on the dance floor. So we have a lot of fun here, and also building individual relationships with people so that they can come to us if they need us. Like if they'll call us and they're isolated at home or they're sick, we will ensure that, the groceries are brought to them and that anything they need, we will go to them if they need that and they're isolated. I also have a couple of seniors that I do daily calls to just to check in and see if they're okay. And, sometimes it's the only time their phone rings in the house is that one phone call a day. So just being aware that they're lonely, and I myself am a senior, so I know that, only but the grace of God go I. So I'm very fond of our seniors, and I make sure that there's a lot of activities available and that their voices are heard. I have community empowerment meetings, guest empowerment meetings, where we meet with our management team, and our seniors attend those meetings, and they let us know what some of their concerns are and what we can bring to the building to improve their lives. Like, for example, a lot of people have difficulty eating hard food because of dentures or just not having teeth. So making sure that we have enough soft products and food around for individuals that experience that difficulty. And when they let us know what they need, we do everything within our power to fulfill that need.
Amazing. Thank you. And I think that you might have been hinting to my next question, or maybe this is a part and parcel about the seniors advocates that you have at the gathering place. Because when I was doing the research, I was really interested in that and ensuring that guest voices are heard in identifying the issues that they may face while there. I'm not sure if it's the same thing, but if it is, do you want to extrapolate maybe further on how you came to know that this is something that was needed as part of the community health center to have an advocate for their voices, because I do think that that's very important and very interesting to have.
Well, in 2017, the Newfoundland government established the Office of the Seniors Advocate. So that in itself is a whole division. And they did a lot of community consultations with our seniors to see what difficulties they had with accessing food, medical care, transportation. And we had several consultations that took place at the gathering place because we have such a large number of seniors that access our center, that this is one of the places that the advocate's office came to do the interviews for their report. So I also participate a lot in anything that the Seniors Advocates Center is doing. So a couple of months ago, we celebrated seniors volunteering in our community. And I think I submitted 10 seniors pictures plus duties that they did in a volunteer capacity. So, we always make sure that our seniors' voices are heard, and that's one of the ways we do it. So if we have a guest empowerment committee meeting at the gathering place and a serious seniors issue arises, we will go to the provincial seniors advocates office with those issues because they have a louder voice than we do when it comes to seniors.
That's amazing. And what a great partnership and initiative that Newfoundland and Labrador is doing. That's very interesting to learn about. Thank you. And Christina, so you there's programs at Rideau that are geared towards senior recreation. And I also saw online that you have files specific to exercises that people can do if they've got Parkinson's disease. So I was curious if you could elaborate as well on the importance of those programs and the impact they're having on the seniors who need them or are attending the recreational activities.
Mm-hmm. So it's a pretty neat model in terms of the exercise program for folks diagnosed with Parkinson's. We do it in collaboration with our local, we would call them community support services, or the agency that provides specific support to older adults. And it's available both in person and virtually. So again, through our telemedicine program, we're able to have folks in different locations all throughout our geography, and they can all participate in this exercise program. Again, geared towards folks who have a diagnosis of Parkinson's. And it's really wonderful because it does a few things, right? The ability, one, to build strength and muscle, because that's incredibly important as we grow older. But also the creation, again, we keep sort of highlighting and speaking to this creation of support systems so that folks aren't as isolated as they either could be or are in the present tense. So certainly the exercise program is very well received, and we love that we're doing that in partnership with folks who have the expertise around older adults and exercise programs. Another example that I'd like to also share is we have multiple programs and services that older adults participate in. And this one is called the Social Kitchen. And it's really a beautiful way of showcasing easy, budget-friendly meals for folks to come and try. And they can take some of the portions home with them as well. So this addresses food insecurity within our community. And you don't have to participate in the making of the meal. You can sit back, you can have a cup of tea, a coffee, or a drink of water, whatever it is. And again, it's this idea of building community. So folks come together, we've got multiple offerings for this social kitchen. Some folks jump right in, and we have volunteers that come to support, and we have participants who have become volunteers to support, jump right in and want to help with the cooking and the prepping and all of those wonderful things. And other folks aren't quite as interested in that. But it's really a great opportunity, and Lucille has had multiple examples of how important it is to bring folks together, create these opportunities for building social supports. And in this case, right, it addresses food security as well, and that folks can, come and have a good meal, but also take the recipe home as well as some of the extras. And that's done in collaboration between our health promotion team, as well as our community dietitian. So again, it's a great internal sort of combination of the allyship of the two programs.
That's amazing. Thank you for sharing that. I love hearing about these programs that you're both offering. So Lucille, I will ask you, if you were to have increased federal or provincial investment for the Gathering Place, what do you think you would be able to achieve at the Gathering Place, either for seniors or even just generally with any increased investment?
Well, right now we have 2,000 registered guests, and we have another 1,000 people that access services that are unregistered. And that's really increased over the last 5 years. I think when I came here 6 years ago, we had about 1,200 people attending. So we've seen a major increase in the number of mental health addictions and poverty in our city. And of course, our seniors are included in that. What we would like to see is increased funding for community health care would mean more meals and more support would be available. We would increase investments in a wider range of services, probably be able to do more home visits, be able to assist people with access to more needs that they may have. Also, health services and partnerships, hopefully we could increase that, but mostly to increase funding to the services that we already have available, because the need is so high in our community and it's very difficult to service everybody with the current funding that we have.
Absolutely. Thank you. And Cristina, the same question. If Rideau magically could get increased provincial or federal investment, what would Rideau be able to do either for the senior community or just the general community and clients that you are serving there?
Yeah, I think it echoes everything that Lucille just said, and I'll kind of sum it up in one sentence, and it would be exactly that: meeting the ever-growing need for those upstream health promotion initiatives for vulnerable folks living in our communities, and that includes our older adults.
Concise and perfect. Thank you so much. That was great. I feel like that needs to be the tagline for the next series that I do. I will send credit your way, but I think that that's a great sentence. I want to thank you both so much for your time and also for sharing what the senior communities, senior clients in your communities are facing, but also from the sounds of like the volunteerism and the programs and all the work that you're doing, you have such a positive spin on something that I think could be feeling a little bit doom and gloom for some of those people. So it was really nice conversation and wonderful to hear both of your perspectives. Cristina, I'll ask you first if anyone here listening would like to know more about these specific programs or just what Rideau is doing over in Merrickville and a little bit beyond. Where would they go online to look?
Yeah, there's a few different ways to be able to connect. So certainly on the web, rideauchs.ca is our website. Folks can follow us on social media. We're on Instagram as well as Facebook. So just looking up for Rideau Community Health Services, and certainly by calling us. So the main number is 613-269-3400.
We love a phone plug. No one ever really does that. So thank you. I appreciate that.
Well, we're speaking about folks who may not have digital access or
Yes.
that digital literacy. So I always try to include a phone number.
I love that. Thank you. I appreciate it. And Lucille, same question. If anyone wants to know anything about the programs that you offered or about the only community health center in Newfoundland and Labrador, which I'm thrilled to be able to highlight, where online or on other platforms would they go to find out more?
Our website is kindnesswanted.ca. They can find out more about us there. And our phone number is 709-753-3234.
Awesome. 2 phone numbers. This is so good. I appreciate this so much. Cristina and Lucille, thank you both so much for your time today in this enlightening conversation. I hope listeners got to take away some insight about what the seniors in your communities are experiencing and maybe implement some of these tools at their own community health centers or, think differently when they're, going out places and seeing seniors in their community. Thank you both.
Thank you so much.
Thank you, Hillary. Thank you.
Thank you for for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.